missionary, legs up with a pillow underneath the buttocks, because once you have the pillow, you actually lift it even up, and there's no way you can miss the G zone.
Dr. Amir Marashi is a renowned physician for his advanced work in cosmetic gynecology and women's intimate health, pioneering this field through performance, biology, and longevity.
Anatomy of clitoris is very important. And unfortunately, it was eliminated from all medical textbooks for almost 100 years. The least satisfying is actually the one from the back, is the doggy style, which could actually be the most painful position for women if they have endometriosis.
Others will have a harder time to have an orgasm. Is that because of the way things are structured inside, or is it more of a mental thing that they struggle to relax?
So one reason is...
Today on the Hack You podcast, Dr. Amir Marashi, a leading physician in intimate health and regenerative medicine, known for his work for helping women restore pelvic tissue health, postpartum recovery, and sexual function. He's also known as the vagina whisperer. Now, we know our audience is male-heavy, but this conversation isn't about aesthetics. It's about performance, longevity, the biology of sex health. For both men and women, we'll get into what really drives libido and sensation, what pelvic health impacts training and recovery, what regenerative therapies like PRP and exosomes may be doing at the tissue level. This episode will change how you think about intimate health.
This one isn't just for the ladies, it's for the guys as well. It's going to be a podcast which will open your eyes, how to improve your sex life, how to maintain optimal sexual performance. And for the ladies, diving deep into designer vaginas, what is the hot topics at the moment, what is trending, why are people going to see him? And this, we believe, is something which is going to be almost normal in the future. We're only a couple of years away of this being a mainstream thing. So sit tight. It's going to be an interesting episode.
This was probably our most intimate, quote unquote, episode. We learned about the G zone, 12,000 nerves compared to 4,000 nerves for men, how the angle of the vagina changes over time and how that impacts the sensations, what can be done to reverse that, what procedures are out there, why he's called the Michelangelo of vagina recreation, and how you can stimulate your partner and bond with your partner better. It's about hacks you can implement in daily life. It's about hygiene. But also, most importantly, we talk about psychology, and that 90% of what goes on in your intimate life is based on how you feel about yourself and how you perceive your partner in that moment. Dr. Amir Marashi, welcome to the Hack You podcast.
Thank you so much for having me.
Mike, what did you think when I said Dr. Amir is coming on the show?
Well, obviously I did a little bit of research to find out who you were, and this is definitely a different podcast, but one which immediately I already had so many questions to ask, and I feel like it's going to be one of those ones where I'm going to learn a lot afterwards for sure.
Dr. Amir, I'm telling you, Mike and I have this experience that the more left field the topic is, the more we learn, and the more the audience actually reacts to it. So this topic about gynecology and rejuvenation of the intimate area for women, but also, as you shared with us most recently, also men, is an incredible, exciting topic for us to understand better, but we wouldn't even know where to start. So the first question is, how did you end up specializing in intimate health?
Well, first of all, thank you so much for having me here. You know what? I started by helping survivors of female genital mutilation. So there are these women who were cut, as a kid when they were 4 or 5 years old, and the clitoris was like literally cut. In some cultures, some African cultures, they do that. And they literally lose the entire sensation and they end up becoming a baby-making factory. So my first basically contact with this field was to help them get their senses back. And imagine the clitoris is cut, there are no nerves there, and you want to bring the sense back. So once I basically proved that we can bring sensation back to them, I started telling my patients who were telling me I don't get an orgasm or I don't enjoy sex that much. I started telling them, look, if they can do it, you can do it. So we started working more and more, initially with women and then women and men. And we saw how much help this can do because, as you know, orgasms are probably one of the most 4 important basically pleasures in your life. There's sleeping, of course, there's eating, and orgasm is another one. Some people say defecating, going to the bathroom is very important too. So these are all at the same level. If you don't have it, your brain is not going to work really. And with orgasms, every time you get a good orgasm, the amount of oxytocin that your body creates, the amount of basically internal morphines, they are 100 times more than if you go to the gym and you kill yourself for 1 full hour. So guys, that's another way to do it.
Yeah.
One good orgasm instead of 100 hours of the gym.
Yeah.
Right.
Was there many other people doing what you were doing at the time, or were you one of the first to get into it?
I mean, I'm one of the first people who did it. Of course, a lot of people, were doing different parts of it, but I tried to bring everything together, especially with the clitoris, for us to know, anatomy of clitoris is very important. And unfortunately, it was eliminated from all medical textbooks for almost 100 years,
Worldwide.
Yeah. So it was in Gray's Anatomy before 1900. And then Freud came and said any orgasm that comes from clitoris is an immature orgasm. And it definitely have to come from the vagina, like from a penetrative intercourse. So anatomy of clitoris went away. When I went to medical school, I never dissected even one clitoris. They told us clitoris is a little prominence that's on top of labias when they reach each other. This top part, this teeny tiny thing is clitoris. That's what they told us. But we didn't know that really clitoris, that's just the tip of it, just like the tip of penis, and then travels down and sits around the vagina. So the size of the clitoris is almost size of a penis, but women pack it inside. So I'm one of the first people who actually created a protocol. Me and my colleague, Dr. Kim, we created a protocol to do an ultrasound on clitoris, and we call it clitogram, and it's actually trademarked and patented and everything. So we look at clitoris and we see how it functions. Now, ultrasound for penises has been around for many years, since ultrasound has been around. But imagine, why didn't we care about this part? Because women don't talk about their pleasure, their orgasm, they fake it. It's very different than men. So I think in that part, I'm one of the few first people, but different parts of it has been done, and it's great that now we can talk about it. And thank you so much it's important for people like you guys who have the platform to bring people like me to talk about it, so other people know that it actually exists. Because a lot of patients say, oh, I didn't even know about it, and I heard you on that podcast or this podcast, and now I want to be seen. And then they tell me, you know what, you changed my life. You're the savior. So
I think everyone can benefit. I mean, even if you were to ask most guys questions about the vagina and clitoris, they probably don't have a clue.
I mean, what you just said, for me, clitoris was the point above. There was nothing. I didn't understand there was anything going beyond that. You're saying it's the size of the penis or
Right.
in that regards. I mean, I just learned that at freaking I'm turning 41 tomorrow. At 41 years old, like, what haven't I been doing for the last decades? From that perspective, I think from a stigma perspective, the stigma is still so out there. So your Instagram account, you have, I would call it probably 3D images of vaginas.
Of course.
That when Mike pulled out his phone and went on your Instagram account in public, he closed your account because he didn't want to look like a creep. It's still to this day, right? We're adults. We all understand. We all want to understand, be healthier. We understand that sexual organs are an incredibly important part of our overall health. I think one of the podcasts that you said was, I think sex is like the second most important thing in your life, like in terms of just from a health perspective. And I fully agree with you. Like, if you want to know if you're a healthy person, as a man, are you waking up with a morning erection, and do you have desire to have sex? Because if you don't, then something's off, obviously, in your overall health perspective. Now, with women, as I said, the stigma is very, very culturally, religiously, they don't speak publicly about it. And then now you are here, who has this public platform, who talks about it, who talks about the things that is most intimate to most people. How do you see the evolution changed in the last maybe 5 years? When you started off like 5 years ago now, do you feel it's more open? Do you feel like more people talk publicly about it? Did the stigma shift?
It's slowly but surely. It's still not something that you can talk about it very openly. And by the way, talking about my Instagram, there's still the stigma. every now and then, I get like 3 of my posts get flagged, and they're like, oh, you got to take it down. And even when you take it down, I don't get suggested. My posts don't get suggested on Instagram. People actually go find me
directly.
And as you said, people feel uncomfortable even opening it. My friends or patients who are actually following me, because a lot of patients don't follow me. They come to me and they're like, oh, you know what, by the way, that post that you put, can I have that procedure done too? I'm like, you're not even following me. How do you know about that post? She says, no, I just go from my fake account and I watch it every now and then. But I don't want people to know I'm following you. So the stigma exists, but people are more curious and they want to learn about it. And that's a good thing. And that just slowly between 5 years ago and now, even between 10 years ago and now, we came a very, very long way. Now people actually come and they ask questions on how I can improve this. Even my patients who were coming to me for other reasons. Now they want to know, how can we change the angle of the vagina, which we can talk about it, because this is all about biomechanics too. Parts of it are in the brain, but parts are biomechanics. And just like sports medicine, we were talking about it. I was going to Sheffield to study sports medicine, and back then, the whole biomechanics was about movement. What happens to your knee joint? What happens to your neck? What happens to your shoulder when you do like a serve, or all of those? But nobody really studied biomechanics of intercourse. But we started doing it, figure out what's the best position in intercourse that you can have the best performance. And as guys,
this will now be the top clip of,
or as ladies,
of our channel.
If you care about it.
Top 5 positions.
Top 5 positions.
Female orgasm.
by Dr. Amir.
No, honestly, this is...
You have a pen and paper?
This is very important. And by the way, since you said that, a lot of guys, we have these classes.
Look, before we continue, can you give us a top 5, please? let's not move the subject.
But no, we do have that class, and I'm gonna teach you. So it's actually, you know what? Since I don't have my props, let's use the glass. So, okay,
Can we get another glass?
No, do you have a pen or something that I use as the penis?
Yeah, use it in the top drawer.
Hold on.
Oh. No, just the pen.
No, the pen.
Thank you.
Okay. So imagine this is the opening of the vagina, right? The entry. What's on top of the vagina? You see the tip that you said clitoris, right? Yeah. But clitoris is not just here. It comes back and it goes around the vagina. So one side of it goes here, one side comes here. And clitoris needs to get erected, just like a penis. You can't have sex with a flaccid penis, right? So same thing needs to happen with the clitoris for a woman to get good orgasm. But 90% of the time, that doesn't happen because there's not enough foreplay or anything, and just basically stick it in. Now, once that happens, the clitoris is not erected, you don't get the orgasm. Mm-hmm. Can a man have sex with a flaccid penis? Absolutely not. But women do it, for different reasons, make him happy, fake it, do this, do that. So you want to first make sure the clitoris is completely erected. And then you want to make sure the angle of the vagina is correct. Now, the vagina normally has a downward angle. So when you enter, it's not really flat. It's like this, right? So the penis goes and it rubs against the front wall of the vagina, the top wall. That's the wall that the clitoris is sitting on, right? Mm-hmm. And that is the wall that has all the nerves, right? It has 12,000 nerves, right? Vadim, tell me, we have 12,000 nerves to stimulate here. How many nerves do you think we have in the penis?
One big one.
One big one. That's, a lot of men, when I ask them, they're like, oh, so if that's 12,000, probably a million? No, it's really, men have 4,000 nerves. Yeah. The same nerves. We only have 4,000, women have 12,000 nerves. So if you can unlock 12,000 nerves and create that sensation, the orgasm in women is by far more potent than men. Mm-hmm.
Would you say like 3 times?
Three times, exactly, because you have all these nerves. So you want to make sure you have
unfair advantage.
You have the stimulation against all these nerves. Now, what happens? So the angle is like this. So we are created. The angle is like this. The penis goes and rubs against that, right? Now, as we age and you have babies and all of those, the angle becomes flat. So when it becomes flat, you're having intercourse. People say, I feel it's loose. It's not really about laxity or being loose. It's really loss of the angle. So the penis goes in. It doesn't really rub against the area that it needs to rub, unless it's a huge penis, comparing it. And it doesn't really create that sensation for the one. So the lady doesn't like it anymore. She's like, oh, it was okay. She fakes it. Now, next time her husband or her boyfriend wants to have sex, she's like, oh, you know what? I have a headache, or I have my period right now, or I'm hungry. Let's go eat first. She comes up with an excuse not to do it. Why? Because it's kind of like going to a shitty restaurant that the food is not good. You don't want to go back there anymore.
Yeah.
But if you can make that a stimulation the right way, which I'm going to tell you how to do it, then, and you get the orgasm as a woman, then you have that cycle that you actually want to do that again and again.
So quick one, that angle, and I don't want to overshare, but I think we know what you're talking about from an angle perspective. That changes over time with age. Is that people who have right away the wrong angle?
No, people don't have right.
Because again, there's childbearing. So if you have childbirth, change the angle. Like what women come to you? What's the most reason they come to you? What age group demographic? What happened to them? Why they ended up in your hands?
Right. So they come for different reasons. And honestly, I get patients from different ages, but most of the time this starts happening after age of 30. Now, look at our face, right? Our faces lose almost 5 grams of fat every year after age of 35. So look at my face. You see these lines. It used to be like this. It used to be cute, no lines here. It was just exactly like this. So you lose collagen and you lose fat, so it starts coming down. Same thing happens to the vagina, right? So right behind the vagina, behind this entry, there's anus here, right? So you have the entry of the vagina, you have the entry of anus, and you have this thick collagen band, we call it perineal body, sitting in between them. As we age, the perineal body loses collagen. Now, if you have a couple of vaginal deliveries and you stretch it, it gets even worse. It's like people who, as they get old, they make a lot of faces too, so they have more lines in their face. So this is the same thing. So it's a combination of both. Now,
so you're saying the more you move, the more you have sex, the more...
And sex is not, as guys, we really want to think that, with sex, we can really make a vagina loose, but it's not really like that, because at the end of the day, vagina is a very resilient tissue. It can basically fit a 10, 12-pound baby through it. So a penis can't really, unless the penis is the size of a baby, it can't really damage the vagina as much as we think it should. Of course, because of the loss of collagen, of course,
so it's more lifestyle and nutrition that has impact on that.
That is really, nutrition is very important in your whole body, because you want, yourself.
Yeah, protein, collagen production.
Exactly. Yeah. So your collagen, your elastin, all of those, you need to give the precursors to your body to make it. And then you need to make sure these muscles are strong. So exercising, like, what are Kegels? People keep talking about Kegels. It doesn't have to be Kegels. I have patients who just do Pilates, or they have a really strong core. And, all the pelvic floor muscles are strong. Because if the muscles are strong, they kind of compensate for loss of, other collagen and all of this. So if you have good nutrition and all of this, of course, you're going to be behind the curve. But eventually, this angle is going to get flat, especially if you start having not necessarily just vaginal deliveries, even pregnancies with pressure inside the belly. So you want to make sure, now let's talk about and by the way, this is a research we did and it's published. You can pull it up and put it on the podcast too. So we did a research to compare different positions in intercourse and see which one is the most satisfying for women. How did we do the research? We used volunteers, doctors, of course, physicians who wanted to volunteer in this. And we did the clitogram. We actually looked at clitoris during intercourse, before and during intercourse. And we saw in which position you get the most amount of erection and blood flow in the clitoris. And now that I taught you about the angle of the vagina, tell me what position you think would be the best stimulation.
I would have thought, because I've heard this from a I had
trusted source.
No, an ex-porn star came on the podcast, and he was saying that there was a technique where you can get the woman on top and move her backwards and forwards on top of you to increase her chances of getting an orgasm.
I mean, the woman on top is a very good position. Why? Because she can change the angle, and she's going to be in control, and she's going to change her body to the way that the penis is going to actually stimulate the front wall of the vagina. That's perfect. But
no.
But
that's not the one. So that's not the money.
So if the clitoris is on top and the nerves are behind the clitoris, so it's on the top part of it.
Very good. So you want to stimulate the front wall of the vagina, the top part.
Vagina, exactly.
How are you going to? Which position would be the best?
From behind.
That's actually the least. So you want to do
really.
So listen, this is woman's butt. It's down here, right? And then it's the vagina. So you really want it. So imagine.
The missionary is the same thing. You go down, you don't go up.
It's here. The legs are up, okay? And this is the vagina, so the legs are up. So what's the position would be the best? Would be missionary, like legs up, woman's legs up, with a pillow underneath the buttocks. Because once you have the pillow, you actually lift it even up, and there's no way you can miss the G zone. And by the way, it's not G spot. People call it this spot. It's not just the spot.
So the 12,000 nerves and the G zone is the same thing.
Exactly.
G zone is the area with the most nerves, just from a vocabulary perspective.
Exactly.
Okay.
So, and it's sitting right on the top of the vagina. So that is why. And if you want to stimulate somebody internally, the best is to, of course, go with the finger inside. And when we want to inject, that's the same thing. We find the G zone. And by the way, we created this device. It's amazing. It's called GynNav. It's a navigation for gynecologists to find the G zone. So you actually go inside and it vibrates, and the patient tells you exactly where is the most amount of stimulation. And that's the area that we inject. So yeah, so basically that's the most satisfying position for a woman. The least satisfying is actually the one from the back. It's the doggy style, quote unquote, which could actually be the most painful position for a woman if they have endometriosis, because it's the deepest intercourse happens actually with, that knee chest position or, doggy style. Vagina gets the shortest. And if women have endometriosis and have pain at the end of the vagina, they get a lot of pain with that. Now, in some women, that's a very satisfying position because
I was going to say, like,
you know why? No, I tell you why. Because there is this cervical orgasm. Right behind the cervix, there are two nerves, uterosacral nerves, but that's a different kind of orgasm. So
that's not the G zone one.
That's not the G zone. That's when you stimulate. That's another feeling from inside that they feel, the whole parasympathetic is working. And that is the same kind of orgasm that would come from anal sex for some women,
Oh, okay.
Okay.
Yeah. Interesting.
Told you it was going to be a good podcast.
Why is there some women that? Because I know there's some that may struggle to have orgasms compared to others. Others will get them more frequently, whereas others will have a harder time to have an orgasm. Is that because of the way things are structured inside, or is it more of a mental thing that they struggle to relax?
So one reason is actually the structure inside, but the most important part is really the brain.
Yeah.
You hit the nail on the head, and this is what happens for men. Over 90% of intercourse and pleasure happens in the penis. For women, over 90% of it happens in the brain. And that's why the brain needs to be ready. They need to relax. They need to really like that person and want to enjoy that sex, and then, it's going to be a very good orgasm. But the 10% of it, that's basically with your body and your clitoris, is the part that everybody's missing. Because for every woman, they know if they're in a relationship, if they really care about the guy, of course, they enjoy everything, more and more. But the last part of it, that 10% that we fix, that you can't fix with your brain, that's really making this area more sensitive.
Yeah.
Which we do with like exosomes, stem cells, before we did with PRP. Sometimes you got to do some surgeries to just fix the angle. Now, even if they don't have that 90% in the brain, once you expose this area and they start having sex and they feel like, wow, this feels good.
Again.
then they go through that cycle that, okay, this is something good. I want to have more of it.
Mhm. So basically, every woman should have the ability to have a normal orgasm.
Absolutely, you can make every single woman have
Mhm.
orgasms. Although some people say, no, I never get internal orgasms, even with like treatments. I prove them wrong.
Okay.
So when we talk about procedures, because you mentioned different procedures. So you say most women after the age of 30 would benefit from seeing someone like you, considering a procedure like that. All women should be able to have an orgasm. So what procedures do you actually offer? And then there's one procedure called vaginal.
Vaginal.
Can you maybe explain that? Because that's, I think, trademarked by you.
Right. So
I think I know where that's come from. It's like Michelangelo.
it's so funny since you have some Russian in you. I tell you, I have this anesthesiologist, very good actually back in Brooklyn. He is a Russian anesthesiologist, and he told me, Lenny. So he told me one day that Murashichka, my last name is Marashi, but they call me Murashka. So Murashichka, you are kind of like a vigilangelo. I'm like, why? It's like, because it takes you, I would sit in front of the vagina before surgery for like 15 to 30 minutes and I make the drawings. I plan the surgery before because it's really important, to fix everything, you need to have a plan. And he told me it takes such a long time. You act like Michelangelo. So that name Vagilangelo, stuck with us. And once I came up with this procedure, we actually trademarked it as Vagilangelo. And that is basically an in-office procedure to improve orgasms and fix the angle of the vagina. So instead of doing a full vaginoplasty, which is, of course, that's the holy grail for vaginal tightening and repairing pelvic floor. Instead of doing that whole thing, which takes a lot longer, we come in the office and we do a few stitches inside the vagina, very specific way, to fix the angle, and we inject the G-zone. So the vagina was like this. Now we bring it from inside, we make it like this, and we inject the G-zone, we make it really sensitive. Now, even if the guy is blind and his penis is this big, there's no way he can miss. And they start getting orgasms, like literally as soon as they start working. So that's Vagilangelo. And I started training doctors on it 5 years ago. So I think so far we have 330 providers globally. It's a pretty good procedure, but there are other procedures. Of course, some people just come for injections. Some people come for labiaplasty, which is just cosmetically, they want everything to look better from outside.
Yeah, can you talk about that? Because I literally drive in Dubai and I drive past clinics and they have that on the outside of the houses, of the clinics itself. And I'm like, is that so in demand that it's like literally like printed on the building? Like, is that such a big demand out there?
Well, listen.
What is it in that case?
So labiaplasties basically make the lips smaller, the lips around the vagina. And, people say, so the amount labiaplasty grew so much after 2010. There are some accounts that say between 2010 to 2017, it grew by 700% globally.
The demand for it.
And the surgeries. And these are the ones that people actually report, because there are lots of doctors who don't really report, the numbers. So they may do the surgeries and they don't really document as many as they do. So for whatever reason. So we don't know how many are done, but there is a lot of demand for it. There was a time that you wouldn't even need to advertise it on Google.
Yeah.
If you had like labiaplasty on your website, you would be the first person on top.
Yeah.
Now, if you want to put an ad, which I don't, because I'm booked for the next 16 months, thankfully. But if you want to put ad for labiaplasty, like the hashtag labiaplasty, I think every click costs you around $5 in New York, which is a lot, because people click and they just, so it is.
So it's skin tightening? What is it?
It's basically getting rid of the lips, making the lips smaller. Now, people do it for different reasons. Some people do it because the skin gets like so much longer and they are darker, so they want to make it smaller and lighter. Some people do it just because they want it to look like the porn stars that they see. there's a lot of porn out there. So people actually see, they didn't know what things need to look like, or because there's nobody really needs a labiaplasty. By the way, let's put this out there. When patients come to me and they say, "Oh, do I need a labiaplasty?" I tell them absolutely not. It's absolutely normal for it to look however it looks. It's like the nose,
It's cosmetics.
Cosmetics. Your nose can be bigger, mine can be smaller, breasts, the same thing.
It's just purely a genetic thing.
Exactly.
Yeah.
And of course, that's something that with intercourse and, having babies and, yeast infections, it can get darker and longer, but it's not something that's needed. So I never really push patients to do it. But if they want to do it, I'm like, make sure you do it the right way, because over 50% of my labiaplasties are actually to fix a botched labiaplasty, somebody who lost sensation and all of those. But yeah, so that's labiaplasty.
Is there a lot of that happening at the moment? Just terrible procedures happening?
Unfortunately, a lot happened because, it's procedure that, the demand for it increased.
Mm-hmm.
And there's no training for it out there. So nobody during let's say, residency, OB/GYN or plastic surgery, there's no actual training for labiaplasty. So we are trying. I'm actually, one of the reasons I'm here, I'm working very closely with this amazing doctor who's really trying to put some checks and balances in cosmetic gynecology, in Dubai and Middle East. Sheikha Dr. Alia Al-Qasimi, she's very good. She's like, look, I love the things that you're doing. So I came here. Of course, I trained her. We trained some other doctors, but we're trying to increase basically, education around it. So it's not just like, just go cut it. Because that's what most of people do when you say that there is written outside the villas that, we do labiaplasties. Yeah, they make it look cute, but they cut a couple of nerves as they are doing it. So we're trying to make that safer as well.
Before moving on to exosomes and other injections topics, because a podcast called Hack You, and Hack You is lifestyle changes and adoptions and optimizing yourself. So before people actually get to you and do any sort of procedures, is there any way to reverse physiologically what's going on in regards to, the change of the angle or the looseness of the skin or any of those things? Because everybody's like, hey, can I drink something? Can I take something? Can I do a certain workout? You said pelvic, muscle building, like is it yoga? Is it Pilates? What would you recommend if you're like, hey, you have no access to a doctor, but you have access to everything else? What would be some of the things you would recommend women to do? And then we can talk about the men also later.
No, of course, about pelvic floor. And then we're going to talk about the whole reverse aging. That's what you need to do. But for women specifically, the first thing is really the nutrition and exercises that they do. So you really need to take care of your pelvic floor. How do you take care of your pelvic floor? I mean, you can do Kegels, but there are other things that are much easier and better for your whole body, like let's say yoga, Pilates, to keep the pelvic floor strong. The other thing is that you want to stay slim. The fatter the belly gets, the more pressure on pelvic floor. Why do we go through so much problems during pregnancy, and why does pelvic floor get distorted? Because the entire abdomen and intra-abdominal pressure pushes on pelvic floor and pushes on diaphragm too. So you see, during pregnancy, breathing is difficult as well. So same thing happens with pelvic floor. So imagine for somebody who is like, for lifelong, they are 400 pounds or 300 pounds. Of course, there's so much pressure on their pelvic floor. So that's the other thing, is stay lean, make sure you exercise, you take care of yourself and you take care of your pelvic floor, and then nutrition. And that's something that you need to tell us, how to basically feed your collagen, how to feed your connective tissue. And, the first thing in reverse aging is really testing. And you really want to test and you see what are you lacking, to replace it. But you really want to make sure you get enough protein. You got to make sure you can repair collagen. You got to make sure you have enough vitamin C to rebuild this. And then very important, especially with orgasms, both for men and women, and people don't talk about it too much, is vitamin D. I can't tell you how many patients I had that didn't get good orgasms or had erectile dysfunction or some kind of issues with this. And when I checked the vitamin D level, it was suboptimal. And they said, I don't care about vitamin D. I'm like, no, you have to take it.
Mm.
And I put them on a high dose of vitamin D, and like literally within a month, 180.
Yeah, I mean, if people forget that vitamin D is a hormone, it's a hormone. Like
It is.
It's like, if I always tell people, if men would treat vitamin D levels like they treat testosterone levels, there would be so much less health problems out there.
Absolutely.
Because they would understand, oh my God, I need to get to the 60 plus range. I need to do, what do I need to do? Do I pills to get in the sun? What else do I do? Testosterone, everybody's ready to inject anything. Here, there's actually a pill out there or the sunshine, and still people don't understand the importance of that. But then has direct impact on testosterone levels, on sex hormones. So you're fully right. And we know, I mean, for the last 8 years, we did probably, last 2 years alone, we see over 1 million people, and 99.9% are suboptimal in vitamin D in all those people, and then report the same thing you're saying. The stress levels are higher, energy level is lower, and all those kind of things. Okay, I understood that. Now, exosomes. So a little bit of prehistory. So we did a podcast here with Dr. Torbjörn Ogeus from Sweden, one of the leading researchers in stem cells, and he's the first one who did human trials with exosomes and has seen incredible results. And we also had a little bit of an off-camera discussion with him in terms of intimate health and how exosomes and stem cells could play a role in there. So in preparation for today's podcast, Mike and I discussed that, where things that used to be a stigma and taboo, either because our society is changing, everybody talks about everything, or because just we're getting older, we're starting looking and thinking about that. So if stem cells are so good for generation of our knees, and exosomes are great for, hair regrowth or face skin, what could stem cells and exosomes do for your intimate health, for women, and finally also for men?
Of course. Look, they can do a lot. First of all, they can like literally make your orgasms 10 times more potent, because they recreate the tissue and they actually help your nerves to repair themselves, and they make the circulation better. And overall, even when you inject exosomes, we were talking about the penis pumps, which we're going to go over that too. Once you inject exosomes in the clitoris or penis, it doesn't just stay there. It takes care of the surrounding tissue as well, which is very important because you want the nerves to basically feel better. You want the vessels to get better because remember, they have a lot of, like between the penis and clitoris, by the way, the anatomy is almost the same.
Mm-hmm.
We can show that. And, the vessels that they have, which is the arteries and the veins, are very similar. And they're very small ones. So they are very, sensitive to any changes. Once you start coming up with like diabetes or high blood pressure, that's one of the first parts of the body that takes the toll, penis and clitoris. Why? Because, you see vascular issues in your legs and limping and all of those, but those vessels are so much larger than the vessels in the penis. So way before that, the person has erectile dysfunction. And that's what I tell people. I'm like, you know what? When you see you have problems with this, let's make sure we do a complete health check. Do your labs, do all of these things, even do a clitogram, ultrasound of the penis, make sure the vessels are good. So basically, to answer your question, it's you can really treat these issues and a lot of other issues with reverse aging using at cellular level, which is both exosome and stem cells.
So just for layman's talk, does that mean the injection is in sight? It's in the intimate area, or can the injection be anywhere? How does it work?
A very good question. So first of all, the IV injections of exosome or stem cells are great. That's the holy grail. Yeah. It works for everything. And your body picks up the areas whatever area that's more inflamed and needs it, picks it up more. And remember one thing, since, just to give you the sizing, imagine a basketball, right? The basketball is the stem cell. It's going around. And then what comes out of it? These exosomes, these tiny, tiny vesicles comes out of it, which are, if you want to compare to basketball, they're like drops of water comparing to the basketball. They are just coming out. And they are the ones who make that communication between different cells and go there, oh, you know what? You have this problem in your skin. Let me fix it. You have this problem in your penis. Let me fix it. This problem in the heart. Now, when we were 2 years old or 3 years old, we had a lot of these stem cells and they were super potent, right? And they would go take care of everything. That's why when you are 2 or 3, you jump up and down, nothing happens to your knee. But you do the same thing when you are 40, you know, you get a tear in your ligament or something
Yeah, recover
happens.
much longer.
You start recovery because our exosomes and stem cells are not as good. Now you start using the exosome and stem cell, and they go and they can repair it. And I think you can become immortal if you get it in your whole body. And that's why a lot of our patients, once they start doing it, the ones who can afford it, they want to do full body treatment. They're like, you know what? I get the IV, I get in my face, I get in my neck, I get in my hair, I get it. And they get high doses. They get like 200 billion IV,
Absolutely.
So
As some of these patients that you're seeing, do they, in a sense, not need it because they're perfectly healthy, but they just want like the best of the best?
you know what? It's funny what you said, not needed. I have, since we talked about a really good friend of ours who talks about it all the time, Eleonora, for example, she would come like every month, every 2 months, and she's like, oh, you know what? Inject me with exosome. But you don't need it. You are really good. You don't have any problems, even she got a compliment from somebody, I don't know, her boyfriend, someone that, everything feels like a pillow inside. And that's the thing. She talks to people and she's like, oh, it's like a pillow. So everybody texts me. They're like, oh, we want it to be like a pillow. So she doesn't really need it. But this is what she told me. She's like, look, can you ever have enough money? I'm like, what do you mean? I said, well, can you ever have enough money? I'm like, I guess no. Because whatever you have, you want to have more. And she's like, look, with health and orgasm, it's the same thing. You can't ever be healthy enough. You can always become better.
Yeah.
You're in great shape.
Mm-hmm.
You still work out.
You still work out.
Yeah.
You can still become Mr. Olympia.
Mm-hmm.
You can still become this. You can still become this. That's the thing about our body. You can always go to a higher level. And that's what we are trying to tap into. Like the patients who really care about this, they see the difference. I have patients who are like, listen, my orgasms are great right now. Yeah. But every time I get this injection, I feel like it unlocks something else. And I feel now I get like 3 times I get orgasms in like 10 minutes. So
it must be quite difficult for you to try and decide how you see your patients. Because I would imagine those that have like the most money and the most power are going to want to keep coming back again and again and again. And then those that maybe, can't afford it.
So I think it's going to change because right now, of course, the ones who can afford it, they get more injections, they come more often. And right now, because of all the rules and regulations around exosomes and stem cells and all the FDA stuff, the labs cannot liberally make them. And the drug companies don't own them yet. And they actually are against them. Why? Because you don't want people to be healthy, then you don't sell your drugs.
Universally, yeah.
They don't talk about your vitamins, they talk about treatment for, Lipitor or whatever, for hypertension or high cholesterol. But reality is that these patients right now, yes, the ones who can afford it, they get better care because they can afford more. But I feel like slowly is shifting and these things are going to become more accessible as the time passes, especially with the new administration in the US. They are changing a lot of things. I think a lot of regulations around exosomes and stem cells are going out the door. And for that reason, there are more right now. It's much more open between Florida, and I believe Utah right now, you can actually inject stem cells, which is crazy.
Yeah.
Speaking of injections, I think one of the first things is, first of all, so the injection site, so if it's an IV, it doesn't matter, of course, but injection site itself would be into the organ.
Exactly.
Now, every man that I know, the moment you say there's injection in your penis, cringes, thinks it's going to be very, very painful. Is that true?
So I tell you one thing. I wanted, first of all, I injected myself twice so far.
Okay.
And the reason I injected myself is that I was trying to put a content on Instagram about injecting penises. And I couldn't do it on anybody else but my dad. So my dad, when he came to visit me, and he's an orthopedic surgeon, I'm like, dude, I gotta inject you. He's like, I don't need anything. I'm like, but I want to inject you. And
That must have been an awkward conversation.
he's like, sure. So you know what?
Hey,
He's my
Dad.
guest. He's my guest and everything. So he's like, whatever, inject me. So I did. I gave him the IV. I injected his face and I injected his penis. And he calls me like literally 2 weeks after that. He's like, what was inside this again? I'm like, exosomes. He's like, and what are they? Because, you know, it's not something he studied in medical school. He's 77 years old. So I explained it to him. He's like, this is really good because I haven't had morning erections for the past 25 years. And I almost got it every single day for the past 5-6 days. So I'm like, wow, this is really working. So you got to practice what you preach. So I put him actually on Instagram, and it was like a few days after that, one of my colleagues called me and said, you know what? People are going to report this. Please just take, I didn't show his penis, but they're, you know what, because you're injecting action inside an organ, you shouldn't be doing it. I'm like, listen, it's research, it's consented by him. But anyways, we took it down. I have to probably put it back on, but that made me want to inject myself to see how it works. And it is amazing. And it doesn't hurt, by the way, that much. You do 2 things for it not to hurt. First of all, you numb the penis.
Okay.
We put this numbing that when you do for the face, you numb the penis.
Yeah.
And you leave it for a good 20 minutes to sit under and get really numb. And the second thing that you want to do to make sure it doesn't hurt at all, you put some ice around it. You give the ice on every injection site. Like let's say you want to inject here, you hold the ice for like 15 seconds, you take it off, you immediately inject. And as soon as you do it, you're done. You got to put a penis pump on to basically bring the whole blood inside the penis and start expanding, you know, the sinuses. And honestly, the only part of it that patients sometimes say, oh, you know, it's a little painful is when you do the glance of the penis. But even that, with enough ice, you don't feel it. And for people who are a little bit, you know, more, you know, squeamish and they are like, don't want the pain at all, you can give them some laughing gas at the same time. Then they really don't feel anything.
Yeah.
They just laugh.
So you're the second person that talked about the penis pump on our podcast, which we're very proud of. Thank you. But you mentioned the penis pump for the purpose of blood flow. The other person mentioned the penis pump for the purpose of actually breaking cells and the exosomes, regrowing those cells, making the penis longer or bigger in that case. Right. Is that something people have reported back to you? Is it more about just the erection, or is it also for size?
No, it definitely increases the size. If you use you guys are the right people to talk about it like this.
Thank you.
As I said before, not about the penis, about I'm gonna put it into the muscle. How do you make the muscle bigger? You know, you feed it and then you try to break it. And how do you break it? By exercising. You know, so that's the same thing that you're doing. You can't give somebody protein powder and you expect for their muscles to start growing. They need to exercise. And the penis pump, that's exactly what it does. It brings the whole blood supply there. And of course, it breaks the sinuses and, you know, cells start to get that inflammation and bring all the blood flow. So now the exosomes can really work where they're supposed to work. And I tell the patients, but the best thing to do afterwards, what do I do? I'm like, just go have sex, masturbate, use your penis pump, and then keep doing it.
To train it.
Exactly.
You mentioned your father was getting the morning wood again. What's the science behind him getting it again, and just the morning wood in general? Because obviously that's usually a sign of good health, that men are waking up with it or experiencing it throughout the night.
So look, first of all, I have a feeling that his nerves became more stimulated. You know, that's one thing. So, and remember, although nervous system doesn't regenerate most of the time, but the exosomes can help repair nerves. And that's actually proven. There are a lot of studies in animals that you regrew the nerves and, you know, worked on them, which I'm going to tell you on the brain even. We do that as well with exosomes. So I think one part is that becoming more sensitive. And then, of course, with the penis pump that I told him to use afterwards and all of those things, you're waking up something that was not being woken up for a while. And of course, he got the IV exosomes too. So I'm sure his testosterone levels got better.
Mhm.
I need to check it again, recheck his levels again. But I think it's the whole picture that got better and he felt healthier. But
Mhm.
he literally, he was telling me maybe in the past 20 years, this would happen like maybe once a month.
Mhm.
Now, sometimes you think is because the penis becomes too lazy because these days there's Viagra out there. And I know even a lot of people who are in their 30s and 40s,
Yeah.
use Viagra. But with him, he said without anything,
Mhm.
he started getting.
There's a common quote which I've heard: "If you don't use it, you lose it." And can you say the same thing about the genitals? If you just don't use it, then it's going to pack up.
Absolutely, it does.
Yeah.
It does. And the more you use it, the better it gets. No
Okay.
question about it.
Yeah. Okay.
The biggest misconceptions when it comes to your work. What's the things that people, when they first hear about you, what they think, and then once they actually get to know your work, what they do, what's the thing that changed in their minds the most? I have to speak to you more in detail.
The first thing they're like, "Oh, why are you a male gynecologist?" It's just, I hear it so many times. They're like, "Why are you a male gynecologist?" Because there are like female urologists out there too. And I think this is one of the most, satisfying basically fields out there. That's one thing. The other thing, of course, about the vagina whisperer, I get heat about it all the time. And when they hear, it was actually about, the story that I told you before, and it's actually helping people. And during the nonprofit work we did, and we helped somebody regain her sexuality and basically come back to the society and everything, they're like, wow, so that's actually something noble. But in the beginning, everybody looks at it and says, oh, this guy with a whole page of Instagram, all like silicone vaginas. But really, the reason we do this, or the reason we did the first designer vagina fashion show, it's really to break the taboo.
Mhm.
Because as long as this taboo is out there, people don't talk about it and they just suffer. And it's suffering in silence. And thanks to people like you or other people who have podcasts or they have a platform, we are trying to break this taboo, because I think it's going to be a much better life and everybody enjoys sex
Mhm.
more, because there's no taboo around eating food. There's no taboo around sleeping, which is, I think, the first pillar of reverse aging is sleeping. I tell people, I'm like, you don't need to come to me if you don't get your good night's sleep, because,
Mhm.
that's the first part of it. Vitamins, supplements, these are all important. But this part, people don't want to talk about it because there's so much taboo around it. And
Mhm.
we are here to break that taboo.
Yeah. Let's talk a little bit about hygiene, because I'm curious about this. How do men and women, but I'm more curious about women, how do they maintain optimal hygiene for their vagina?
Oh, I mean, one thing that people think, there's so many like vaginal washes and this and that out there, if you're talking about that kind of hygiene. And, vagina is a self-cleansing organ.
Mhm.
It cleans itself. So as a matter of fact, when you start washing it and putting soap in it and all of those,
You make it worse.
you kill all the good bacteria that's there. You end up getting yeast infection. So I tell people all the time that, even like Dove, even like this shampoo, that shampoo, I'm like, even nothing. You cannot use anything inside the vagina. You can put some water,
Mhm.
Or you can add a little bit, very small amount of vinegar to water and just sit in it. But nothing more than that, because at the end of the day, you don't want to kill all the good bacteria that's in there,
Mhm.
because you end up, messing up with the pH of the vagina. And that is very important. Every product that I work on, the first thing about it is that you want to make sure it keeps the integrity of the pH of the vagina.
So when it comes to smell and what you just said in terms of actually vaginal, whatever, soap is not good. But there's people who their intimate parts are smelling,
Of course.
and their partners are telling them that, or their friends are, or hopefully somebody's telling them that that's the case. So in that case, A, why is it smelling? And B, what should they do?
So usually the smell you are talking about, because yeast doesn't smell, is from bacterial vaginosis. So overgrowth of the bacteria that's inside the vagina, that's bacterial vaginosis. And it's a fishy smell. Usually it has a little bit of gray discharge with it at the same time as well. Now, that is because the pH was off and they ended up getting bacterial vaginosis. The way to get rid of it, they need to see their gynecologist and they get treatment for it. But afterwards, if they're careful, hopefully they don't get it again. Or if they get it, they can easily, fix it. Now,
Is it antibiotics? Is it
antibiotics?
pill?
No,
Okay,
that's
it's
an
antibiotics.
antibiotic.
Okay.
But if you take the antibiotics and you keep the pH okay afterwards, then hopefully you will not get it. But most of the time it happens because of some issues with hygiene. Like, for example, they having intercourse, the boyfriend or the girlfriend is playing with the area without washing their hands, or they go back and forth between anus and the vagina. All of those things can basically throw off this bacteria and you end up getting bacteria, or BV, they call it BV, bacterial vaginosis. That's usually the smell of the vagina, which is the fishy odor. Other than that, most of the time, with simple just cleaning with water and maybe adding a very small amount of vinegar, white vinegar, that would be helpful and get rid of it.
Would it be safe to say having sexual intercourse in the sea or swimming pools or hot tubs is generally not a good idea?
Hot tubs, absolutely not.
Yeah.
The other ones are okay if it happens, but you are messing up basically with the pH of the vagina, especially like in the pool because of all the chlorine that's in the pool.
Yeah.
The other day, I don't know, in the ocean, sounds fun, but
It's fun.
Sure.
It's better than in the pool.
It's definitely better than
Well, you probably should not be doing it in the pool. It's not fair for everyone else.
But no, and then the other thing is that don't use saliva. That's one thing that I tell people. People say, "Oh, what about the spit?" I'm like, "Please don't." So you want to get some kind of balanced
lube.
What about could lube and even latex? Because some women are allergic to latex.
Right. So the women who are allergic to latex, you got to use something other than latex.
Yeah.
And of course, there are condoms
Sheepskin.
that are not sheepskin.
Okay.
But definitely use condoms if you don't know your partner, both for men and women. I've seen so many, horror stories myself.
Yeah. This is a really random one, but I know, like, from doing podcasts and watching lots of podcasts, there's always this topic about porn and how bad it is for men to watch porn and just touch themselves and watch it all the time and how it can impact sexual performance. I was always curious to know, because a lot of women have toys. Now, if these toys are getting more and more advanced,
efficient,
like they are, compared to the penis, it's making the penis look pretty bad. So if women are overusing these toys regularly, is this going to impact actual real sex and their ability to orgasm? Because the penis isn't doing all the...
So, you know what? And that's a very good question you asked. And let's just talk about toys, because I actually design toys. But
you're probably the guy to make a good toy out of it.
I don't call them toys. I call them tools.
Yeah.
So it's really not a toy. It's a tool. And when we wanted to start making them, I actually came with this biomechanical engineer who is a radiologist at the same time. So we wanted to really dissect all the toys that are out there to see which one is good, which one is bad, and which one really works. First of all, a lot of toys have a lot of plastic in them, so it's not good. You want to really get something that has medical grade silicone. I'm going to get back to your question. Medical grade silicone. But what's really important, you got to make sure it's really stimulating the areas that it needs to stimulate for it to work. Now, will it make guys look bad? And would women want to have only sex with their toys? Absolutely not. I actually tell guys all the time, what's the safest and the best threesome? It's you, your girlfriend, and a toy. You should call it a tool. So you actually have to have a tool yourself. Imagine the man bringing the tool. And they ask me why, but I have the penis. Of course you have the penis. How many times can you go with your penis? So imagine you are tightening the screw with your hand, right? How long is it going to take you to tighten it? It's going to take you 1 minute. Now, if you have a screwdriver, you can tighten 5 screws in a minute.
Mm-hmm.
Now, if you have an electric screwdriver, you can tighten 50 screws in a minute.
Yeah.
So imagine the power of your penis plus another tool. Then she's going to be going crazy. And I think that's the way to use it, and I don't think there is ever a limit for orgasms. They can always get better. And remember, it will never replace a man or a woman, depending on your sexual orientation. Because what? Because it doesn't have that emotional part. And remember, for women, we said 90% of it starts from the brain. Now, you want to make sure you're in charge of making that 90% ready. And then your penis and a tool, there's no way she would want to go anywhere else, because that would be the best orgasm.
What do you reckon is the best tool then?
Best. So, we actually created a toolbox. It's so funny. We have a toolbox and we are like, for Christmas, you got to give this toolbox to your boyfriends. And it's like really a toolbox. And it has a bunch of stuff in it.
Interesting.
Yeah.
Okay.
What trends are currently happening in that sphere that you see are growing your client base? So what's going on? What are people talking about that ending up with you or talking to you? What do you see?
So, you know what? It's so funny. The shape of outside. People really are obsessed about the shape of their labia majora right now.
Yeah.
So a lot of people talk about, we want the labia majora to be smaller. So labia majora is those 2 big lips that you have around the small lips, right? So before, I used to say 10 years ago, everybody wanted Kim Kardashian kind of body.
Yeah.
And it was like, oh, I want hourglass. I want the butt to be big.
Yeah.
So they would get fat injected in labia majora to make it big.
Yeah.
And make it basically bulge out of their tights that they are
Yeah.
wearing. Now everybody wants European labia
The
majora.
opposite.
They want everything to be small. Yeah. And now we remove a skin. Especially the biggest trend that's happening right now is all about the Ozempic labia majora and Ozempic vagina. Why? People lose a lot of fat around there, and the skin is hanging so much. Yeah. And the inside of the vagina feels looser because of all the fat that they lost. Now, it's not like the vagina is becoming looser, but imagine a woman who were, let's say, 120 kilos, right? She was big.
Sure.
And what happened? She had a lot of fat around labia majora, and now she lost all the fat. Now that cushion that she had around is not there, and her partner tells her, well, everything is loose. Now she wants to get rid of that extra skin, but she wants to make sure that she still has that kind of tightness.
The tightness, yeah.
So that's the biggest thing. And I feel
so we went from voluptuous to European.
Exactly.
That's and then the Ozempic impact, obviously, body fat reduction impact. You don't have that, is it called pillow feeling or whatever that feeling is. Okay, understood.
What are some of the best things that women can do post-pregnancy to kind of get back to how everything was prior to getting pregnant in the first place?
Well, you know what? I think actually they should start before pregnancy and during pregnancy to keep the pelvic floor really strong. That is very important, So if you there are pelvic floor therapists out there, or good trainers who can help you keep the pelvic floor strong. I tell patients, if they are exercising, like if you're in childbearing age and you want to get pregnant, make sure you do a lot of core exercises to make sure your core is strong. That's going to help you have a really easy breezy delivery and pregnancy, and at the same time, make sure your pelvic floor is, because if you have the good muscles, even when you go through this, they can bounce back easily. And then you continue the same thing afterwards. Of course, during pregnancy, you can't do it as much as you were doing it before pregnancy, because of course it's the oxygenation and you are pregnant and all of those. But you start, let's say, at 100% before pregnancy. During pregnancy, you go down by like 50%, 50%. So you still continue working out at 50% of what you were doing. And then again, afterwards, you go back and you do all the pelvic floor muscles.
So I can imagine there's a lot of women who are quite put off by the idea of getting pregnant because they love their body so much. And they're like, oh, I don't want to lose this. But then at the same time, I've seen some women who've had multiple children and they look amazing. Like you couldn't even tell that they've been pregnant before.
Absolutely. Especially, look, I mean, if you look at, and I have a lot of patients who are like bodybuilders, women,
Mhm.
and if you look into them, some of them had like 3 or 4 kids,
Mhm.
and then they bounce back so nicely, and you see the muscles. I mean, if I pay attention, the only thing that sometimes I see, it may be like a little bit of umbilical hernia because
Mhm.
the muscles get separated during the pregnancy and all of those. We can easily put it back together. But most of the time, they bounce back very nicely. So
Yeah.
it's all about your baseline. If you start with a good baseline,
Yeah.
and that's the same thing. Look, I mean, what's our best friend really is lean muscle.
Mhm.
If you have that good baseline, even when you are like 70, 80 years old, it's going to be helpful to you. It's going to be helpful to your joints. It's going to be protecting you against everything. So that's the same thing that for pregnancy is exactly the same.
You mentioned steroids there. It's quite interesting. There's definitely certain steroids that women can take, which is going to change the structure of the vagina. They start to,
the clitoris is growing.
Yeah,
it becomes more like a small.
What is the steroid that is causing that to happen?
Did I say steroids?
Maybe I did in my head, but no. Yeah.
No, I definitely didn't say
so you said women. No, you said female bodybuilders.
Yeah, bodybuilders. Yeah,
so he said female bodybuilders.
Yeah,
sorry, I just automatically was thinking about. Yeah.
No, listen. I mean, testosterone is amazing. Honestly, testosterone, I give it to a lot of my patients, male and female. And you want to be optimized with your testosterone. Of course, not during pregnancy. And that's something that can help you, with your muscle mass. It can also help you with, keeping a good, weight. But of course, you need to know what levels you're going for. And you can't overdo it, especially for women. And it's really good for libido and orgasm. Especially for women, more than men, believe it or not.
You don't want to overdo it.
Yeah, you don't want to overdo it. For women, definitely you don't want to overdo it.
Yeah.
Dr. Amir, thank you so much for today.
Of course.
One thing, just from a takeaway perspective, when people start doing those exercises or the treatments that you recommended, what would be some of the changes that they feel about themselves that you would say would prove that whatever the treatment was is actually working for them?
So the changes they feel and their partners feel are usually they're like, I feel the quality of tissue is different. That's not just in the vagina. I mean, I just injected a good friend of mine here in Dubai, and I injected in their face. And like literally 3-4 days after, I got a text message. You know what? I feel the quality of his skin is very different. So that's usually the first thing that women see, because they see what's happening in their face and they see what happens in their hair. So I always try to do those at the same time. But then they tell me, you know what? I feel, my orgasms are very different. I feel like I get stimulated much easier. I feel I get wet, much easier. And then of course, after a few times when they have these treatments, they're like, well, the feeling inside for my partner is very different too. They tell me it feels like a cloud or like a pillow or something. And by the way, we do with the vaginal procedure, as I lift the vagina, I create this pillow inside the vagina because, first of all, it fixes the angle. Second thing is that when the penis goes in, this part of the penis at the bottom part, down the frenulum, that's the most sensitive part. And that goes right over the pillow. So the guy goes crazy too. So
everybody's winning.
Everybody's happy.
Well, depends how long he lasts.
That could be a problem. Then we're going to inject him too.
Or you can get some tools.
But you know what? Believe it or not, women are really good creatures in this sense. They are all about caring about their partner, the man. And that's why a lot of times, they want to make the man happy.
Well, yeah. Sometimes
they fake it.
Yeah, sometimes they care so much that they can't relax because they're so worried about pleasing the guy. But a guy is so easy to please, so just chill. Please, he's going to get there.
We only have 4,000 nerves. It's not that hard.
It's not that hard. And that's what I tell women. I'm like, listen, and this is very important. This is like one takeaway from the whole podcast. If any woman is listening, I tell them, look, you got to tell the man what makes you feel better. If this part is more sensitive, just tell him what position. You need to be vocal. Don't just think about him, because men are like puppies. They want to make the owner happy, and they would really do that for any woman. If the woman tells them, what, I prefer this position, it really makes me feel good, they would do that because they want to make sure you get happy. So you see, if you don't teach your puppy and be like, oh, come inside, they pee here, they pee there, you don't tell them anything, what's going to happen? The puppy thinks that's normal and you're fine with it. But as soon as you tell them, what, you have to pee outside, then they learn. So to any woman who's listening, really tell your guy, because it makes the relationship so much better too.
Yeah.
Awesome. Dr. Amir Marashi, thank you so much for your time. It was an absolute pleasure to talk.
For having me.
And as we hoped and wished, turned out to be exactly the kind of episode that we didn't expect but learned a lot from.
Yeah. Where can people find you on socials?
NYC GYNO, NYC Gyno. That's the Instagram, and I have all my links there.
And unfortunately, there's a 16-month waiting list, you said.
So that's in the New York office and Miami office. So we opened a new office in Houston. And believe it or not, because taxes are so much lower in Houston, the prices are slightly lower in Houston too. So a lot of New York patients right now, they come to Houston because I have more immediate availabilities in Houston. So
Amazing.
Nice.
And then we come to Dubai too, so they can see me here as well.
Amazing. Thank you very much.
See you much more. Thanks so much.
Thank you so much.